Can we talk about race? Utilizing art as a catalyst to facilitate discussions about race and medicine. Presented by Quinta Fernandes and Alexis Flen from the University of North Carolina at Chapel Hill School of Medicine. Can We Talk About Race was an event conceived as part of the annual Paul A. Godley Art of Medicine Fellowship to continue efforts of inclusive and anti-racist curricula and culture at UNC School of Medicine. The fellowship is awarded to 2 rising second-year medical students who demonstrate a commitment to education and social justice in medicine. Can We Talk About Race serves as a curricular enhancement of several core educational competencies in social health and systems and professionalism. The goal was to utilize art as a vehicle through which to address race and inequality in medical education, particularly in the preclinical setting. We collaborated with Ackland Art Museum in Chapel Hill and developed innovative adaptations to the clinical virtual learning environment. The process began by selecting the works of art. We collaborated with Elizabeth Mannequin, the head of university programs and academic projects at the Ackland Museum, focusing on artists who used art to express their experiences as people of color in the United States, and who used strong elements of symbolism that would elicit various interpretation of the works by different people. We chose the artist Willie Cole, an African-American artist from New Jersey, specifically the pieces Man, Spirit, Mask, and Sapphire from his series, The Beauties. Together, we developed a schema that allowed us to help students develop skills for reflection and how to interrogate their opinions and observations. We put first-year medical students in small groups of about 25, along with us as facilitators for the discussions over Zoom, and had the art displayed electronically when we couldn't be in the museum itself. We utilized close looking at the art with guided questions like, what do you see? What makes you say that? What evidence in the art can you point to support those observations? And how did those perspectives compare to those of your classmates? As fellows, it was important that we learned how to facilitate, and we had prior received training in art and teaching and developed skills as educators. Students learned about how interpretations differ based on a person's background and life experiences, and exploring how pattern recognition and clinical concepts that we base on race in education can skew perspective and understanding of each other in patients. Through these sessions, students explored and discussed multi-layered sentiments of race in the context of society, medicine, and culture. Here we see Man, Spirit, Mask, produced by Willie Cole in 1999. It is a triptych in which Cole uses iron as a motif to connect with the painful and lingering histories of racial oppression which mark the experience of African Americans in the past and present, and contrasts that with a celebration of their ingenuity, perseverance, and also in celebration of the service of domestic workers. Similarly, Cole uses these similar motifs in his work Sapphire by the Beauties, produced in 2012. What we're actually looking at here is a print of the underside of an ironing board. Many students noted, as was intended by the artist, that they saw within it many different things, anything from a bullet to a shroud to a stained glass window or the well-known Brooks slave ship diagram. Here, students were able to relate the different perspectives and life experiences and how they were able to come to such different conclusions despite looking at the same piece of art. Results. Post-survey questions sought to qualitatively evaluate the effectiveness of the session, which included providing comfort in discussing race in an open forum, understanding the formation and intricacies of personhood, and its significance in patient care and public health. We polled and asked about the quality of the discussion and if students noticed any differences in how they discussed race at this event in comparison to the conversation they would normally have surrounding race in informal or formal settings. Here we see many of the feedback we received from students that we put together to qualitatively assess how this impacted their experience. Many stated that art being the main focus allowed them to remove the safeguards and barriers and preconceptions that they have about discussing race, that it is difficult, and that the medium helped them address the elephant in the room, so to speak. Many also found that the guided reflections helped them learn how to challenge and evaluate their own biases and pattern recognition in the way that they think. We also received valid critiques about how, though the session could be useful, something as important and serious about race, like race, should be discussed with concrete examples grounded in evidence and reality, and found that students should be comfortable being exposed to race in a more formal manner. In conclusion, overall, students reported satisfaction with the seminars, and it showed that there is demonstrable need for open discussions about race in medical education beyond what is typically provided in standard curricula. Art has a catalytic impact in conversations about race and has the capacity to eliminate personal reservations and vocalize observations in an open forum. Thank you.